The nation needs public policies that strengthen research and development, improve quality of life, and support continued investment and job creation across our economy. Regardless of how one looks at our nation's ever-changing medical landscape, it is clear that healthcare and economic issues are inextricably intertwined. The U.S. healthcare sector accounts for more than 17% of our nation's gross domestic product. Incidentally, that's a 1.1% increase since just 2008. While most industries have lost jobs in the recent recession, healthcare has consistently added jobs. The U.S. Bureau of Statistics estimates that the industry has added nearly 700,000 jobs since the start of the recession. And today, as most of you know, healthcare is the #1 employer in most cities and regions around the country. Over the past year, we've convened leaders from a wide variety of fields, ranging from patient groups to industry to academia to labor, to discuss how the United States can retain its leadership in medical innovation. We can learn a great deal from the nation's innovators and health leaders. Throughout these discussions, we've heard a common theme. That theme is America must move forward with a dedicated and aggressive medical innovation agenda that will help get our economy back on track, facilitate the work of innovators and scientists, and bring to market products that will address some of the world's most pressing medical challenges, and in the doing, help save healthcare costs for everybody. Today we're calling for the administration to give an appropriate federal office the responsibility to lead collaborative efforts to address the key challenges that we face. We need and must have coordination of this effort from the highest position so that we can make sure that all the things that need to be done in the government and the private sector get done over time. We believe the following 4 areas to be the priorities for the near term. First, we must form public-private partnerships that will drive translational research and bridge the valley of death. The gap between the development and delivery of life-saving medicines and treatments. Put simply, we're leaving too many of the greatest ideas and innovations in the laboratory without providing sufficient energy, resources, or mechanisms to bring them to the patients who need them the most. Second, we believe we must create the right market environment that enables innovation to thrive. One immediate opportunity that exists is to strengthen the federal research and development tax credit by making it permanent and raising it to levels that make it globally competitive, thus providing the incentives to further public-private partnerships. Going forward, we must also adopt tax and economic incentives to boost manufacturing and export-related job growth resulting from medical innovation. Nowhere is there a better opportunity to drive new jobs than through the medical research and innovation arena. Third, we must enhance regulatory sciences efforts at the Food and Drug Administration by funding a collaborative effort to implement a science-based benefit risk framework guided by government, patient advocates, and industry. This is critical to bringing about the best science and the best ideas as the FDA reviews and approves biomedical innovations. And fourth and finally, It's incumbent upon our nation to do everything in our power to ensure that we're cultivating the next generation of innovators and researchers. Without them, without the young talent, without the young researchers, our chances of ensuring our long-term competitiveness and addressing our planet's most pressing health challenges will be greatly diminished. Both Congress and the administration have made great strides in this area, but we need to do more in the way of providing targeted federal support for the biosciences in K through 12 science, technology, engineering, and mathematics, what we call the STEM educational efforts.